Doctor, what are the symptoms of joint degeneration, or when to meet a doctor?
The predominant symptom is definitely pain, and initially it occurs only during more activities like climbing stairs or turning around and pain. Then there will be some stiffness. For example, if the knee joint is involved, there will be some difficulty in moving the joint to full range. For example, he cannot squat. When he tries to squat, it will cause pain. So pain, stiffness, and sometimes there will be some swelling also. As I earlier mentioned, the bones rub against each other, some fluid will collect in the joint. This pain, swelling and stiffness, if it persists for more than 1 week, then the patient should definitely go and see a doctor to rule out any joint damage.
Okay. So how to diagnose such cases, doctor?
Initially, after the clinical examination, that is by seeing the joint and palpating and feeling the joint, so when X-ray is usually needed. After seeing the X-ray, you can see whether there is any degeneration of the bone, and in some cases you may need some blood investigations to rule out some infection or some arthritic problem like rheumatoid arthritis, etc. We have to rule out by taking some blood investigations. By this preliminary clinical examination, X-ray and some basic blood investigation, you can detect what's happening in the particular joint.
Okay. And in such cases, how will you proceed, doctor?
Again, it depends on the stage of the disease. As I mentioned, it can be mild or moderate or severe. In mild cases, you can do some simple measures like medicines to reduce the pain, swelling and stiffness. And physiotherapy is very useful in the early stages of the disease, where we do some physical measures to control the pain, to strengthen the muscles, reduce the inflammation. And some exercise will be taught, and which the patient has to continue at home. And most of the cases, if the patient continues to do the exercises, there will be no problem. But what happens is, after the pain subsides, the patient will not do the exercise, then it will again aggravate and it causes more trouble. So then comes the moderate cases, which is in between cases, that is not mild but not severe enough for a joint replacement. In those cases, sometimes what we do is a keyhole surgery, an arthroscopy to remove the damaged cartilage, debris, and actually it's something called the cleaning up of the joint, and it gives good relief in most of the cases if done properly and in reasonably early time. And then comes the severe form, that is the joint is totally damaged, that smooth articular cartilage is lost completely, then we have to do a joint replacement surgery.
You talked about mild, moderate and severe cases. Is there any difference in symptoms in these cases?
Yeah, in mild cases, as I mentioned earlier, you get the symptoms only while you do more stressful activities, or you do something which you normally do not do, like when you try to squat, when you try to sit cross-legged, or when you look up for a long time. These are the symptoms in the mild cases. In moderate cases, you get symptoms even while doing normal activities. If you sit for 10 minutes, 15 minutes, you may get neck pain. If you walk for some 5 minutes, you get knee pain. Then it is moderate. In severe form, you will get pain even while resting. Even when you sleep, you tend to wake up in between due to pain. That is very severe case.
Doctor, can you just explain more about arthroscopy?
Yeah, arthroscopy is commonly called as the keyhole surgery. It's like viewing into a room through a keyhole. We make actually 2 holes. For example, if it is doing an arthroscopy in the knee joint, which is the most commonly involved joint, we make 2 holes, and through one hole we put a small cannula, and at the end the camera will be attached, and through the small camera, you can see the whole of the joint. And through the other keyhole, there are 2 holes. Through the other hole, you put your working instrument. Through the instrument, you do the surgery. Sometimes the articular cartilage, that is the smooth surface at the end of the bone, it can be broken in only some selected places. Those can be smoothed out. It can be reshapen and made more smooth. If it is totally damaged, arthroscopy cannot cure the disease. But if it is in patchy, only in small areas, then we can smoothen those surface. And sometimes what is called, we get the joint debris, that is the degenerated material which can be collected inside the joint, which causes the fluid accumulation. And those debris can be removed. And in between the joint, there is this cartilage surface called meniscus. It's like a shock absorber between the 2 bones. And that meniscus can sometimes, in degeneration, that is also frayed up and torn sometimes. That is what we call as a degenerative tear. That frayed meniscus can also be trimmed and shapen. And somewhat normal anatomy can be recreated in early stages, which gives a long-lasting pain relief in most of the cases, provided the proper post-operative physiotherapy is continued by the patient.
Okay. And after this arthroscopy, how many days the patient has to stay in the hospital?
Normally, it's in Western countries, it is usually done as a daycare surgery. That is, patient gets admitted in the morning, gets the surgery, and he goes in the evening. But in our country, it's we normally admit the patient the previous day, do the surgery, and the next day the patient leaves.
We have heard about the sports person like getting injured like after sports or something. Like, will they be able to regain their sports activity after this arthroscopic surgery?
Arthroscopy is mainly meant for young people with who get sports injuries. Mostly, it's what happens is in the sports injuries. There are some structures called ligaments which connect the two bones. These structures hold the bones together. In severe sporting activities, sometimes like in football tackling, this ligament gets torn. So the knee will be dangling without the connecting structure holding the two bones together. So that structure can be repaired through the keyhole surgery, and that structure can be recreated. And after 3 months, normally that structure will work as the ligament, and the patient can start playing again, normally after 3 to 4 months of rest.